widespread testing is important, because without it we don't have visibility on where the infection is. But it's not sufficient. Just testing is not an infection control strategy. Testing tells us where the infection is, but then we have to do all the things we're talking about. We have to really zero in on when we identify a test, what services can we do to keep the person safe at home, isolated, out of contact, keep healthcare workers safe. Like, all of those things are necessary if the testing is going to allow us to do anything good on controlling the epidemic. So it's been easy to sort of blame not having enough testing, because it's easy to understand why that's a problem. But having enough tests doesn't get us where we need to be. We have to do local public health infrastructure. We need massive investments in local communities and their health departments to be able to do the contact tracing in a sustainable way, because until we get a vaccine, we're going to be having to do this. We're going to be having to do contact tracing and community outreach and going to people's homes and making sure that healthcare facilities have PPE. We're going to be having to do this for a long time, frankly. It might be a year or more, or 2 years before we've have the tools in place to eradicate or stamp out the infection altogether. So those things, and I think, I'm really encouraged to hear that there's potentially some investment in the legislative package about investing in local public health, because that's clearly what's needed. Like, we have to do this at local public health. Otherwise, we can have all the tests in the world, and we're not going to do anything good with them unless we can do contact tracing and isolation and quarantine. That's really how you stop an epidemic. And we need to, we'll get there, but we need to really build the public health infrastructure in a way that we never have before.